morning, guys. It is Sunday the 9th. It's about 10:40.
What month is it?
Oh my goodness, February. For a little while longer.
2020.
Yes, 2020. We're going to be talking about joint health today. So right here on aisle 3, it's like one of the first things is our section for joint health and like arthritis and turmeric. So one of the first things is MSM. It's a naturally occurring organic sulfur compound found in animal and plant tissues that's essential for just overall optimum health. Research has shown that it does help with pain and inflammation. There have been reports of benefits to patients with arthritis. High doses, and I would say the research I found was 3,000 milligrams twice daily, was shown to be safe and effective at helping patients with osteoarthritis, especially when used in conjunction with collagen.
I know they give it to pets.
Yes, it's not only for humans but for animals as well. It's something that would be safe and effective if they have any issues with arthritis or hip dysplasia.
A lot of dogs get like arthritis in their hips. When they
Yeah,
get older.
especially bigger dogs.
And we have one customer to buy 24 bottles at a time.
MSM.
Yes. Of how
Then they
to
got that cream too.
send to her country.
And what about like, don't you combine that with chondroitin and glucosamine sometimes for dogs and
It's
humans?
the first 3 items on our list are going to go over
Oh, yeah.
MSM, glucosamine, and chondroitin. Glucosamine is involved in the formation of nails, tendon, skin, eyes, bones, ligament, and heart valves. It's made in the body from simple carbohydrate glucose and the amino acid glutamine. It's found in high concentration in joint structures in the form of glucosamine sulfate. I think all of ours, except for the vegetarian, is glucosamine sulfate.
Isn't that coming from an animal source?
Glucose, shellfish. A lot of it comes from shellfish, except for the vegetarian. And the vegetarian, looks like it comes from bicalcium phosphate. Helps to combat the helps to combat the causes and symptoms of osteoarthritis. Also shown to help with acute injuries such as one would get from over-exercising and just general joint health. Supplemental glucosamine can be helpful for tendonitis and osteoporosis. So it can also slightly reduce the destruction of cartilage and depression caused by taking non-steroidal anti-inflammatory drugs. So taken with chondroitin sulfate, it's even greater effect on osteoarthritis. So especially when you combine all 3, we'll talk about chondroitin next, for things like osteoarthritis, pretty much any joint problems. So next we're going to talk about chondroitin. And so we don't actually have chondroitin by itself. So typically I would suggest taking one that's combination where you're doing glucosamine and chondroitin, or MSM, glucosamine and chondroitin. So chondroitin is an important element in the creation of cartilage. So cartilage is the tough yet flexible connective tissue found in joints, where it acts as a cushion and in other parts of the body, such as the tip of the nose and the outer ear. So the way it works is it attracts water to the collagen and elastins and holds it there. So that's important for maintaining healthy joint cartilage. It also helps protect existing cartilage from premature degeneration by blocking certain enzymes that destroy cartilage and prevent nutrients from being transported to cartilage for repair. Taking supplemental chondroitin, and so a lot of chondroitin will come from shellfish or pulverized shark cartilage, or cow trachea cartilage. And it's another one that has been, research has shown to be helpful with things like osteoarthritis. A little something about chondroitin: it shouldn't be taken with any anticoagulants, as it's chemically similar to blood thinners.
What is that?
Say-
Anticoagulant.
Anticoagulants, it's like, so if you're on blood, anticoagulant keeps your blood from coagulating, thickening.
My ex actually takes some because he
What is
has
a
an
blood
artificial
thinner?
heart valve.
It's similar, it's chemically similar to a blood thinner. So if you're on blood thinners, it's not suggested to take chondroitin because it will thin it too much.
If you're already on blood thinner.
Right.
Okay.
So, you know, taking all three of them together can help with pain, inflammation, padding the joints. It's that glucosamine again that is going to help draw that water, that fluid to the joints to help keep it padded. So internally, to work systemically throughout the whole body. So, you know, topically, like the cream that we carry, the Nature's Plus Ultra RX joint, that you can use just on the directed affected area. And today we're only talking about how these pertain to joint health. I've actually given y'all information on like as much of the benefits as I could find. So next we're going to talk about Boswellia. We've got a couple of different brands, Carry Naturally and Now. So Boswellia, as it for joint care, it acts as an anti-inflammatory and anti-arthritic, used topically for pain relief. So it's going to be useful for arthritis, gout, low back pain, and can even help repair damage to blood vessels caused by inflammation. So like if there's damage to the joints or the blood vessels in the joints or anything like that, it can actually help repair that blood vessel damage. Sarah, would you grab the, see if we have any of the topical Boswellia cream in stock? Just show that as well. It's in the health and beauty section, but it's also could be in the joint section.
Just the
Okay. No worries. We'll get Kieran to get some more. So the Boswellia cream that can be applied topically to help relieve pain. Interesting about this product, it also contains capsaicin, which is the compound in peppers that makes them hot. Together, they will help to relieve topical pain. And of course, that'll penetrate deep and go into the joints and muscles as well. Okay. Next, we're going to talk about shark cartilage. And this, after we talk about shark cartilage, we'll just talk about cartilage in general. So, shark cartilage contains a number of active components, the most important of which is a type of protein that acts as an angiogenesis inhibitor. So what that is it supposedly acts to suppress the development of new blood vessels. So For instance, many cancerous tumors are able to grow only because they induce the body to develop new networks of blood vessels to supply them with nutrients. So the way that this pertains to joint health is, so, you know, we talked about earlier the chondroitin coming from a lot of times sharp cartilage. It being a cartilage, our bodies will actually recognize that cartilage to help produce more collagen and cartilage, and that's how it's going to help with joint health, to help keep those joints padded and help make sure that the cartilage is healthy. So that's going to make it really good for conditions sorry, like arthritis, arthritis, tendonitis, any kind of joint problems. Now, if you're taking large quantities, you should increase your supplementation of certain minerals, especially magnesium and potassium, to maintain a proper mineral balance in the body. What happens is it takes away minerals from the body, and so it's very important to make sure that you maintain that mineral balance, because especially your magnesium and potassium, if that gets low, you're going to start having cramps, become irritable. Short cartilage should not be taken by pregnant women or children, or by persons who have recently undergone surgery or suffered a heart attack. So if you have anybody come in asking about the short cartilage, that's something that, you know, they need to be aware of, so that we can make sure that they're not taking something that's going to harm them.
How long is recent?
I would say within a year. I would say a year, 6 months to a year, just to be safe. They didn't actually say how recent, so that's just kind of what I hate making assumptions, but that would be my assumption, is, you know, maybe 6 months to a year. Next, we're going to talk about hyaluronic acid. So hyaluronic acid is a substance that is naturally present in the body. It's found in the highest concentration in the fluids of the eyes and the joints. So the way it works is by acting as a cushion and a lubricant in the joints and other tissues. In addition, it might affect the way the body responds to injuries. So if people are having joint problems such as like bone on bone, or they've not got enough fluid in their joints and that's causing the pain, then taking hyaluronic acid, or even hyaluronic acid with the combination of the three we talked about earlier, the glucosamine, chondroitin, and MSM, that can help with the fluid, so that we're making sure that we have a proper fluid balance in our joints. Then taking it with the other three, that's going to help with the pain, the inflammation, and mobility. So that's going to make it good for things like osteoarthritis, joint pain. There's a disorder called Cashin-Beck disease. So what that is a disorder that affects the bones and joints, usually in people with selenium deficiency. So I've actually, I've never had a customer that had this disorder before, but if you do have someone coming in about that, then hyaluronic acid would be a good supplement for them to take to help combat the symptoms of that. It's also really good for people with shoulder pain after they've had a stroke, which I thought was very interesting. Next, we're going to talk about tart cherry. Tart cherry is going to, like in large doses, so you can eat like 2 pounds a day, or take it supplementally, 2 pounds fresh, or take it supplementally, to help with things like gout and arthritis. So there's compounds in the cherry that help with like uric acid crystals that can build up in the joints and cause gout, pain associated with gout, and it also helps to relieve inflammation. And so a lot of people who, you know, whether it's because of dietary restrictions or whatever, may choose to do tart cherry instead of something like glucosamine to help with that inflammation.
You said 2 pounds a day, that means fresh cherries?
Fresh or canned,
Okay.
or well dried or canned, yeah.
And could the tart cherry be taken with the glucosamine chondroitin MSM?
Definitely. All these things actually, depending, you know, it's always best to check with your pharmacist to make sure if you're on any prescriptions. But everything that we're talking about today could be taken all together. And so a lot of our combinational supplements are going to have several of those things already in one pill, or one dose. Serapeptase. So serapeptase. It was probably 6 years ago. I had a customer come in, he had sarcoidosis, which is a scar tissue in the lungs. So he was telling me that serapeptase can actually help eat scar tissue and scrub the joints. Air quotes, scrub the joints. So the way serapeptase works is it helps the body break down protein, which in turn can help reduce inflammation. Pardon me. So that's going to make it good for, you know, things like back pain, osteoarthritis, rheumatoid arthritis, osteoporosis. People have even gotten good results with fibromyalgia, carpal tunnels. So if anybody's having like pain or inflammation or any kind of joint problems, serapeptase would be a good enzyme that they could take to kind of help reduce the amount of protein buildup that can be causing the pain in the joints like that. That in turn makes it really good for other things as well. So a little off subject, but if anybody comes in with kidney stones, that would be
I'm a little confused about the breast pain caused by too much milk production. Not that, because that really hurts, but what exactly does it do to help that? Is it going to affect milk production, or just...
So again, it works by helping the body break down protein. So there's a lot of protein in breast milk, and that's how it would help to reduce that pain.
Yeah, like
Is
Cause the pain.
right. So it would help
for
break
a woman
down.
nursing, it wouldn't affect her milk production. Like, would be
It should
safe for
not
nursing women.
directly affect it to the point where it would like dry it up or anything like that, but it should help to reduce the pain and swelling associated with it by reducing that inflammation and helping to break down the protein more efficiently.
So that would be a really good one for people who've just had surgeries,
Yes.
things like that.
And especially, you know, like as it pertains to joints, so like say if someone had like a knee replacement, and to help with the scar tissue and just any buildup of that protein, by removing that, helping to break that down, that would be a really good one to take to help. Pardon me. One of the most popular things that I see selling here to help with inflammation and pain is turmeric. So turmeric, you know, it's good for everything, but so the active compound is the yellow pigment, and that's going to help help reduce inflammation, and through reducing that inflammation, that's how it's going to help with pain. So it's really has really good anti-inflammatory properties. and it's going to be good for any kind of arthritic conditions. You know, a lot of times, a lot of those autoimmune disorders like that, it just, the inflammation is like off the charts, and so that's how that's going to help, is to reduce that inflammation. So when we take it together with black pepper, which is, so this is the only one we have on the shelf right now. It's Planetary Herbals Full Spectrum Turmeric. It's the only one that we carry where it's only turmeric extract and black pepper extract. And it is the black pepper extract bioperine, which is the patented one. So studies have been done where if you take bioperine with turmeric, it can help you absorb the turmeric something like 2,000 times more efficiently. I actually encourage people to take the bioperine with all their supplements, because that, or well, one, because that helps us absorb all our nutrients better. Pardon me. Another whole herb, whole food that's going to be good.
Justin,
Yes, ma'am.
back to the turmeric.
Yes, ma'am.
I have some concerns as to which one to choose. Personally, I have inflammation that's in my knee.
Mhm.
So, which one? How can I don't have any pain. Just have swelling and inflammation.
I would say either the Once Daily by Solaray, which is just an extract in capsule form, and then so any of the turmeric would be beneficial, but for what you're describing, where it's just inflammation, I would choose just
and tightness, you know.
a plain turmeric
Mhm.
or the turmeric with black pepper.
Okay.
So like if customers notice that they've been on turmeric for a while and it's just not quite helping as much anymore, what happens is we build up a tolerance to it, and that's why it would be a good idea to start including that black pepper extract with it so that we can absorb it better.
Okay. Is it true that black pepper aggravates your gut?
It depends on how sensitive the people's stomach are. I mean, so like, I'm not suggesting that you add like actual peppercorns, black peppercorns. It would be less irritating if you took it in supplementation form, because that's only going to be the extract from black pepper versus like the actual pepper.
I know, because when we took the Terra Naturally class, they made reference to black pepper
Mm-hmm.
not being good for your gut. It causes leaky gut.
That's something that we should look into. I'm not sure.
Okay.
Yeah, we'll look into that.
Okay.
Remind me next week, and we'll see what we can't come up with.
Okay.
So ginger, and we've got it in our digestive section. The root is going to help fight inflammation. Pardon me. And that's how it's going to help with things like arthritis, joint pain, and any kind of inflammation, just because of its anti-inflammatory properties. Back to what you were asking about leaky gut.
Mm-hmm.
So if you add the ginger with the turmeric, or with the black pepper, that's going to help protect your stomach and your liver.
What now?
Ginger.
Okay.
So that would be something like, if you're worried about black pepper extract causing leaky gut, maybe take a ginger with it. You can also coat your stomach with aloe vera first as well. That may help.
Okay.
Let's see. Okay.
It got rid of it. TMJ, like, locked off. It's, oh, okay.
What did?
Turmeric is what Andrea was saying for TMJ.
I had to take, like, prescribed anti-inflammatories for a long time. And
Yeah.
muscle relaxants. We were about to do surgery. And literally between an anti-inflammatory diet and taking mega doses of turmeric, I'm not doing surgery. So it's all gone.
Yeah.
Unless I eat too much sugar. Then it comes back.
Next, we're going to talk about bromelain, and that's another one that's in the digestive section because of its. So it's an enzyme that's found in pineapple juice and in the stems of pineapples. And what it does is it causes the body to produce substances that fight pain and inflammation. And so what that's how it, it's going to be much like ginger as far as like the anti-inflammatory responses and helping to relieve pain. So that's going to make it good for like any kind of like knee pain or osteoarthritis. It would be something very good to take to help with pain after surgery. Any kind of tendon issues or tendon injuries. And also it's going to help. So say someone overexercised, they overextended themselves and they're sore after, they could take the bromelain to help reduce that pain associated with overexercising.
Really, really good for sore throats too.
Sinus inflammation.
Just like literally a juice. Well,
Yeah.
It's like 1,000 times better than all the other stuff for sore throats.
Pineapple juice?
Just pineapple juice.
Yeah.
You're supposed to get the core though, I've heard, because the most bromelain is in the core of it, so if you juice it. Then
Right.
It really, really works.
Yeah, it was saying stems and juice.
Yeah.
Next we're going to talk about fish oil. So fish oil contains essential fatty acids. There's vegetarian sources as well.
The sunway is feeling vegetarian omega weight down.
That's not entirely true.
Is it?
No.
Which other one is? Well, the only vegan one, I should say.
Yeah. Alright.
Like, clarify.
So fish oil and vegetarian sources of omega fatty acids are going to be really good for any kind of like arthritis, overall joint discomfort, and so that's going to help work with the fluid and also the lubrication. So it's really good to help not only keep the whole body lubricated, but like the joints, and that can reduce inflammation as well. So it's pretty much good for every system in the body. It's probably one of the supplements that would be good to take daily. Just, there's a few things that I would say, they're good to take daily for everyone. Of course, if you have dietary restrictions, again, we have vegetarian options. Sun Warrior is a good omega-3. Vectomega, if I'm not mistaken, is another good one from Terry Naturally. That's if I'm not mistaken, that one's vegetarian as well. High doses, I would say, I think research shows over 9 grams a day, 9,000 milligrams, would be high enough to thin the blood, so that you don't want to get that high, because if it thins the blood, that can, that's not healthy. I think around 1,000 to 1,500 milligrams is typically what most companies suggest as far as like what the amount that they want you to take daily.
Is that a fish oil or omega-3s?
Omega-3s.
How much?
So what-
How much omega-3?
1,000 to 1,500 milligrams. That could be safely taken 1 to 3 times a day. Pardon me.
So DHA is working in the brain. Is that an anti-inflammatory also?
The DHA and EPA content, that's 2 of the primary fatty acids that are found in omega-3s. So the information that I found was saying they didn't really say DHA or EPA either way. They were just saying overall omega-3s. So I assume the combination of the 2 together. And that's something else that we need to look into. I'm gonna get you to make me a note. As far as like, is the DHA or the EPA, the anti-inflammatory properties of that. DHA.
There's DHA and then there's DHEA.
Yeah.
Which one were we asking?
DHA
DHA.
is one of the one of
Danielle
the
is D what?
EP.
DHA.
DHA and EPA.
Okay.
Those
I didn't
Question is,
realize
are
they
they
were.
anti-inflammatory properties? Is that the question?
yes, our question was, does DHA or EPA, which one has anti-inflammatory properties? The DHA, as Harinam Kaur was saying, is very good for brain health. I'm not even going to attempt to pronounce EPA and DHA. So some good.
So I didn't realize these were all in omega-3s, and I had been reading about 3, 6s, and 9s, and then also 7s and several other.
So a good one, if you're not vegetarian, a good one that's going to be a combination of all of them would be like the Solgar Full Spectrum Omega. So this is going to be, your omega-3s, but it's also going to have your 5, 6, 7, and 9 as well. And so like you can get omega-3s also from flax oil, or it was borage. No, I'm sorry, borage is gamma-linolenic, GLA. So a good vegetarian source, similar to the Solgar Full Spectrum, would be the Sun Warrior Omega.
The GLA is an omega-6.
Thank you. So this is going to contain, much like this one, you're getting omega-3, 6, 7, and 9. So pretty much the only two that, the only one that this does not contain that this does is that omega-5. Either one of those would be a good full spectrum product where you're getting all those different essential fatty acids. So we're going to go next to magnesium, and that will take us into malic acid and magnesium malate. We're actually out of malate on the shelf. So magnesium is one of those essential minerals that we should be getting on a daily basis. We need it, I would say, every day. So it's a vital catalyst in enzyme activity, especially the activity of those enzymes involved in energy production. So to assist in calcium and potassium uptake, a deficiency interferes with the transmission of nerve and muscle impulses, causing nervousness and irritability. So supplementing it can help prevent depression, dizziness, muscle weakness, twitching, PMS, and aids in maintaining the body's proper pH balance and normal temperature. So that pain relief, as it acts as that muscle relaxant, can help with pain associated with, any kind of pain. It also is necessary to prevent the calcification of soft tissue. And that's another way that it's going to help with joint pain, is so that, as we age, that calcification, it's like calcium crystals almost, starts to build up, and that can cause pain.
The question of, often in nature, calcium and magnesium are found together.
Correct.
And in many of our products, we actually sell calcium and magnesium supplements.
Yes.
So does that mean that you can still take it that way and not have to worry about the calcification on the joint?
Yes. So the magnesium, especially magnesium, calcium, and vitamin D3, they all work synergistically together as far as like helping each other to absorb more efficiently. They're all essential for bone health. So pardon me, it should be, well, to be on the safe side, if you have overactive calcium intake, then I would probably suggest not. So like if you're having a problem with any kind of calcium buildup anywhere, I would suggest not taking any more supplemental calcium to go with it, and maybe just take some magnesium to help start breaking that down. And then maybe afterwards, if you're back balanced, it would be okay to take some calcium at that point.
Nature's Plus used to have a magnesium calcium supplement, which
Mhm.
meant it was stronger or more abundant in the magnesium and less in the calcium.
Right.
And our rep many years ago recommended that for the female cycle, that the week before the flow and the week of the flow to take more magnesium and less calcium, and the other 2 weeks of the month to take more calcium and less magnesium. And that helped the emotional balance, it helped the craving of the chocolates, and it helped just the general well-being of the female body during those times.
It is probably one of,
And that's probably got to do with inflammation.
yeah. Well, and I mean, and just the aspect of it acting kind of like a mineral muscle relaxant. So, you know, I could totally understand where that would be beneficial. You know, it's even good for people who have problems sleeping because of its relaxing properties.
The powder stuff is really nice at night. That calm powder.
Yes.
Yeah, it really is.
It'll give you, let's take this week.
Yeah.
I was just gonna keep that.
It
You
also
gotta start slow.
It also protects the arterial linings from stress caused by sudden blood pressure changes. It plays a role in the formation of bone and in carbohydrate and mineral metabolism. When you combine magnesium with vitamin B6, also known as pyridoxine, it helps to reduce and dissolve calcium phosphate kidney stones. It may help prevent cardiovascular disease, osteoporosis, certain forms of cancer, may reduce cholesterol levels, effective in preventing premature labor and convulsions in pregnant women. So if people have a possible deficiency that can manifest by they being confused, having insomnia, irritability, poor digestion, rapid heartbeat, seizures and tantrums, can be synonymous with diabetes. Deficiencies are at the root of magnesium are at the root of many cardiovascular problems. May be a major cause for fatal cardiac arrhythmia, so that's an irregular heartbeat, hypertension, sudden cardiac arrest, asthma, chronic fatigue syndrome, chronic pain syndromes, depression, insomnia, irritable bowel syndrome, pulmonary disorders, that's lung, kidney stones. It's very important for individuals who have or who are considered at risk for developing cardiovascular disease. And so the way I chose to talk about magnesium malate was to first go over magnesium. So magnesium malate
Can you
is
show me
where,
the bottle you're talking about?
yes. Well, no, we're out of stock on the magnesium malate.
Okay, okay.
So similar would be malic acid. So malic acid, and this is actually, yes. So magnesium malate, which lives right here, is magnesium salts bound with malic acid. And so that's going to work similarly like tart cherry as far as helping with symptoms like where excess uric acid crystals causing gout, that inflammation. And that's why we have it offered either by magnesium malate or malic acid in the joint section. Because of its ability to act like similar to tart cherry, and being since it's magnesium, that's going to help with that that relaxation and pain relief.
So it's helping to reduce inflammation.
Correct. So it's going to be good for the joints, especially if it's associated with things like gout. Just work.
Also fibromyalgia.
Fibro. Yes. Thank you. Say again.
Fatigue.
Yeah. I didn't write anything down about CBD. I've already given you guys something on that, but it's going to help with joint pain as well because of its ability to help with pain and inflammation and autoimmune disorders, much like rheumatoid arthritis. So, you know, we have a couple products where they're going to combine like turmeric and other herbs and supplements that are good for pain and inflammation, in addition to this with the CBD to work synergistically. So it's like, you know, when you take combinational supplements like the Herbal Naturals CBD plus turmeric, or like the Solgar number 7, you're going to be getting several things that are going to be in one dose from one product that are going to help combat all the different aspects. So it's like pain and inflammation, mobility, the fluid. So for instance, Solgar number 7, that's going to combine several of the things that we just talked about, like the turmeric, the ginger. This has boswellia, it has cartilage, it has a spice pepper complex that works similarly to like black pepper to help us absorb everything better. And so that would be one that could be taken just one a day to help combat overall upset joints, or, you know, any kind of arthritis or just overall joint pain. I know. Yeah. Words are hard. This one is actually called number 7 because the company says that you should notice an improvement within 7 days. So I actually suggest if a customer chooses to get this, you know, give it 10, maybe 15 days, just to see. You know, everybody's body is different. We metabolize things differently, so it doesn't always work the same. Pardon me. And now this would not be good for vegetarians because it has that type 2 cartilage in there. It comes from chicken breast bones. So, you know, that, again, that cartilage, whether it's shark cartilage or any kind of cartilage, our bodies are going to recognize and produce more collagen to help pad those joints. So for vegetarians who want to take something to help with that padding the joints, they could do bamboo extract, which helps the body produce more silica, which in turn, or I'm sorry, it has silica in it, which in turn helps our body produce collagen. So that's how that would be good for the joints. And then there's the BioSeal or the Super Silica. Those are 2 more vegetarian options to get that, to get our bodies to produce more collagen. So like the CBD plus turmeric, they're gonna, you know, turmeric and CBD totally, but they're also went so far as to actually take a curcumin extract and add it to that, so it's even stronger on the turmeric content because you're getting turmeric and curcumin extract. They included MSM and boswellia, as well as the black pepper in this.
How much CBD is in there?
It has got 15 milligrams per dose. So So when it comes to turmeric, back to one of Kathy's questions earlier as far as which turmeric should I take, you know, we've got just plain turmeric where it's just going to be standardized turmeric in a capsule. We have extracts of curcumin where that's all it is, where it's just that active compound, curcumin. So it's from turmeric root, but it doesn't contain turmeric. It just has the curcumin, the active compound. So even though the milligrams are not as high on this, it should absorb and utilize more efficiently because it's like when we standardize an herb. So it's like only the active compound versus our body's pulling the active compound from the supplement. Some of the customer favorites when it comes to inflammation and joint health, I see the Curamin Extra Strength, and what this is a combination of boswellia and turmeric or curcumin extract. That I see move very well. Customers love the turmeric once daily. This is starting to pick up the turmeric extract with black pepper. The Mega Food, I think it's, Tony, you've been taking this one, right?
Mm-hmm.
The Mega Food, turmeric strength for whole body or for joint. Both of those are going to help maintain healthy inflammation responses. So like this one is going to combine the turmeric, but also tart cherry, berry extracts, holy basil, and it has that black pepper extract in there as well. The joint is going to have the ginger in there, the boswellia, devil's claw, and the turmeric extract as well. And then this company also includes that black pepper extract in there so that we can absorb it all better.
Hello? Yeah.
Okay, questions on anything?
Okay, so we went through the turmeric. So are we back to my question as since you explained about each one of the turmeric? Which one will be the one that you suggest? Are you still here with
Turmeric, for what you have going on, I would suggest maybe starting with the turmeric once daily. And then if you notice that it's not absorbing as well as it was, if it's not working as well as it was, maybe consider adding the black pepper extract to it, or choosing the one by Planetary Herbals that has it in there. And then if you're worried about leaky gut syndrome, again, you can add like the ginger, like maybe take a chewable ginger or a ginger capsule with it so that you're protecting that stomach. Or you can do slippery elm. Slippery elm works with the mucus lining, and that would help protect. Aloe vera would help coat and protect as well. No more questions?
Don't we have biopairing?
We do. So in the digestion section, biopairing, that's that patented black pepper extract that I was telling you guys about, helping just any nutrients be absorbed more efficiently.
Can you tell me, Justin, if any of these ingredients in the Sun Warrior collagen work to promote chondroitin?
Kathy, do you have your prescription for nutritional healing?
No, but I'll get you one.
I'm gonna double check.
So bamboo, what did you say about bamboo?
Bamboo has naturally occurring silica in it.
Right.
and that's how it converts in the body to collagen.
So it does collagen, but not.
I'm gonna look up food sources for chondroitin and see if it's going to. So if I'm not mistaken, non-vegetarian sources are most likely going to come from some sort of cartilage, whether it be shark or cow.
Or the chicken you mentioned.
Correct. So that's something else that I would like to do is find.
So is there a vegetarian source?
That's something that I want to. I'm going to need to look into is a vegetarian source, because the prescription for nutritional healing does not list a vegetarian source,
Okay.
but certainly there's probably one out there. It
Maybe we
may
have to
not
make our
be.
own.
Yeah.
Thank you.
You're welcome. Thank you, guys.
Thank you, Justin.
Excellent. All right, everybody have a great day.
Very, very good, very
And-
well done, Justin.
Oh,
Yes.
And thank you
thank you.
for your hard work.
And thank y'all for your hard work. Everybody have a great day.
You too.